Hi guys, I'm Dr. Sonahita Agarwal and I'm back with another small video with a question that every one of us asks, every one of my patients ask is retention, retainers. Doc, is retainers necessary? Can't we do just, without retainers? What are retainers? Why do we need them? And we had braces for so long and now you're asking us to wear retainers. So these are the questions that we are going to answer in this video. So first of all, when you complete orthodontic treatment, you should know that you are moving teeth through bone, right? It's like moving a biological entity through biological entity, and you expect everything to be still after treatment. That's not so. So teeth have a strong natural tendency to come back to their original position, and that is what we call as relapse. So you must be seeing many people, including me, after orthodontic treatment, we were not compliant, we didn't want retainers, we were so happy with our smiles that we did not wear retainers, and after a few months, everything came back to their original position. Not original, but everything was messed up, right? So to prevent that relapse, retainers are required for the bone to be stabilized, for the teeth to be stabilized in their natural position, in their positions that we have set, because naturally they were in a crowded position, they were front, and then we have used force and we have moved them. Now these teeth are connected with the bone with fibers. They are like elastics, they are like rubber band, you are stretching them. So once you remove the braces, there is a tendency that everything comes back, right? So to prevent that, we need retainers, right? Now the question they ask is how many months, how many years? So let me tell you that nobody will answer this question. Invisalign, for one, the clear aligners, they have written retention is for lifetime. Nobody wants to take that responsibility of saying 1 year and then you remove your retainers and it comes. So it varies individual to individual, right? Retention as much as possible is good for us, good for you also. But then patients don't agree with that. Patients are like, we have been through so much, 1.5 years, and now you're asking us to wear this for lifetime. You just tell us one simple term, that time period, how much. So what I tell my patients is that you wear the retainers, you wear it for 1.5 years. The amount of treatment time you had, the same amount you wear it, and then taper it down, right? Taper it down in the sense is that if you're wearing it 24 hours, then after maybe 1 year you can wear it for night times. After 6 months you can wear it for alternate days and see whether your teeth are actually not moving, they're stable, they have accepted their new position, and then you can get away with it, right? So that's the thing. But still, my personal opinion is that it should be for life, or it should be as long as possible you can manage. So now retainers are of 3 types basically. One is Holly's retainer, that's the oldest retainer that have been given like since ages. I also used to have them. It has an acrylic plate and a wire that comes in front of your teeth. So that wire is actually stopping from your teeth moving. So that is one thing. You have to remove it while chewing and while brushing, and you have to keep it in water in a box. So that is the oldest and the best. I feel it's the best retainer. Why? Because if there is some minor relapse, you can correct it. You can do some wire bendings and you can activate it and correct it. But aesthetically and comfort wise, it's not that great. So patients complain because there is a plate, so that interferes with speech, and that wire is unsightly. So after braces, you don't want any wire, and this is there. So the next type of retainer is clear retainers. This is what my patients love and what I prescribe mostly, because it's invisible. You have to remove it while brushing and eating, but once you wear it, nobody knows, even you get used to it very fast. And you have to wear it 22 hours, but then after that you can taper it down, like I said. Now third type of retainer is the most comfortable one, where you don't have to remove it, where you don't have to bother about it. So that's lingual retainer. It is bonded on the lingual inside surfaces of your teeth, and it stays there as long as possible. Now this is the most comfortable thing because you don't have to remove it, you don't have to maintain it, you just you can do anything but except for biting from your front teeth, and it's aesthetic also, it does not show, right? The main problem with this is that if your lower teeth are hitting somewhere while chewing or something, while biting, the while tends to come off from any of the teeth, and you won't know about it. The patient doesn't know, and the tooth starts moving. And once it reaches that position that it's noticeable, that's when the patient realizes and comes back and says, "Hey doc, my teeth has moved, my tooth has moved, and you fix it." How will I fix it? You know, it's up to a limit I can fix it, but if it has moved so much, how can I fix it? So that's why I'm really scared of lingual retainers. Lingual retainers I suggest only when there is good clearance, there is good maintenance, and then I like to support it with clear retainers also. So if the lingual retainer comes off, at least they have the clear retainers to maintain the teeth position. So there are different costs for this. You can ask your doctor about this. These are the basic 3 retainers that we have, and retention is very, very, very important. When you're spending so much for your teeth, you need to maintain them. Just like you buy a car and you get the servicing done every year, that way you need to maintain your teeth in their position, and you have to wear retainers. So this is for today, and I hope you like this video. Share it as much as possible, like and subscribe to my channel, and I'll see you again next week with something interesting, right? See you. Bye.